We have at this point very good data, consistent data from a number of studies showing that about 70% of all youth in the juvenile justice system meet the criteria for at least one mental health disorder, and that about 1 out of every 4 youth in the juvenile justice system have a mental health disorder serious enough to require significant and immediate help. So one of the things that's happening in the justice system is they're honestly feeling overwhelmed with the large numbers of youth in the justice system who have mental health needs, and for the most part, their inability and lack of training for really responding to those youth. For the youth themselves, the difference is that many of these youth simply do not need to be in the juvenile justice system. It's one of the major pushes right now is that youth ought not to go into the justice system simply to get services. That's not what we should be doing with our youth. We should be getting them services in the community where they need them and where they're most effective for them. For the society, what we're learning is, in general, simply putting people in institutions is not an effective way to respond to youth. That in most states, the recidivism rates, the number of youth who come back into the system, is around 65% to 75%, meaning almost everyone who goes through the deep end incarceration ends up being rearrested. I think probably one of the most difficult things in this area is that I think we all understand that the problem cannot be solved by a single agency. And so on these Action Network teams, we do not require just that the Juvenile Justice Agency comes in terms of juvenile corrections or probation or detention, because to deal with the problems of behavioral health issues, you need a whole variety of different people at the table. Ideally, 5 to 10 years from now, what we would love to see in the Action Network states, but honestly throughout the country, are a series of pieces that are put in place. One of them is that, in fact, we do not put youth in the juvenile justice system just to access services. Secondly, for those youth who end up having to go in the justice system, and some of these kids do things that require them to be placed in the system, we ought to be making sure when they have mental health issues that we're providing them with effective programs. And then lastly, for those youth who are in the programs and who are coming out, we have to make sure that we're doing the linkages to make sure as they return back to the community, they're linked to the services, back to the families, back to the schools that will help reintegrate them back into the community rather than just starting the cycle all over again. So it would be wonderful if we could do all of that in the next 5 to 10 years.